and pull your leg up higher. And then push again, push, push, push. So back pain off to one side. Now this is caused very frequently by a joint down through here that many people haven't even heard about. It's called the sacroiliac joint, and it will give you pain right in through there. It can be very painful, standing up from sitting down, bending over, and going up and down stairs. Now what we can do is we can release off that joint to get more movement through this area, and also a very specific exercise to release the tightness and muscle that builds up around that area. So the sacroiliac joint is basically where your pelvis connects onto your sacrum. Sacroiliac joint. It's these joints through there and through there. Now it gets very, very painful. You can get sharp pains, you can even get an achy pain right in there. The way we're going to release it is by straightening off through this whole area, releasing the pelvis with a specific MET technique. MET is a muscle energy technique. It's where we use muscle to correct the pelvis. So let's say the pain's on the left side for the purpose of this. So lie on your back, and I want you to grab one knee, the painful side, bring it up to your chest, and the MET part, muscle energy technique, is you're going to push your knee hard in this direction against your hand. So I'm pushing my knee that way, but resisting with my hand. So push, 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 and you hold it there, pushing pretty much as hard as I can for 10 seconds. And then what you do is you release the push and pull your leg up higher. And then push again, push, 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 hard as you can for 10 seconds. And what this is doing is it's helped to realign your pelvis and relax and pull up. So you're realigning your pelvis, because very often with a sacroiliac problem, the pelvis is slipped anterior. We need to release it and bring it back. If you use your muscle to push hard, you're actually pulling the pelvis in a posterior position. So what we call posteriorizing your pelvis. So do that for 3 lots of that 10-second push, and do that a few times a day. Now, once you've done that, what you've also done is released off the muscle through here. So we're going to get deep into the muscle now with a tennis ball to release off the tightness that builds up around that joint and causes excess pain on top of the problem that you've already got. So I want you to get a tennis ball, and you're going to place it on the floor, and then you're going to lie or sit on the ball. So pretend the ball is here. You go onto the ball exactly where the pain is, and then you pause on it. So I'm pausing there. It's very, very painful. You keep that pressure there until you feel the pain dropping down. And then you move to a new area, find more pain, pause on it. Very, very painful, but you wait there until it eases off. If it's too painful just with the tennis ball, pop the ball on the floor, get a folded towel and place it over the ball so there's padding, so it's not quite so forceful into the area. You're going to find that gives a bit more of a relief. And then just pause on it, and as I say, let the muscle release off. So those are the 2 things that we need to do. Release off the pelvis with an MET and get a tennis ball deep into the area to release that tight muscle. Any questions on these? Pop it down in the comments. I'll do what I can to help.